Other parts of the world are reporting an increase of COVID-19 cases, but new COVID-19 cases continue to decline statewide. While West Michigan saw an increase in cases starting about this time last year, a local doctor says he's hopeful that this fall and winter are different.
That we're kind of getting into the respiratory virus season.
Cold and flu season is here, and COVID-19 has not gone away.
In August and September, when I was in the hospital, I was actually seeing some of the sickest people I've seen in a while with COVID.
Dr. Andrew Jameson with Trinity Health says he's still seeing pretty regular admissions for people sick with COVID. More than 12,800 cases were reported in Michigan in the past week. That's the lowest 7-day average we've seen since April. Kent County is still at a medium-level transmission rate, though, with nearly 6% of hospital beds taken by COVID patients.
I don't see us going back to a massive wave where we have, unfortunately, hundreds of people dying in our community. I don't see that happening with COVID, and that's awesome and exciting.
So as people catch a cold or the flu, he's encouraging everyone to keep in mind the things we learned during the pandemic.
So when you are sick with a respiratory illness, if you're coughing, sniffling, if you feel kind of crummy, absolutely wear a mask for a little while, because it's going to save, the person next to you from having to call in later, or it's going to save, someone else's grandma from getting hospitalized from influenza.
And Dr. Jameson says the latest Omicron subvariants are more aggressive in reinfecting people. So with these colder months ahead, he's encouraging people to consider getting the latest COVID booster. People who are 12 and older who haven't gotten a vaccine in the last 2 months are eligible.